And let's stay there in Deir al-Balah and speak to Olga Cherevko, who is from the UN Office for the Coordination of Humanitarian Affairs in Gaza. Welcome to the programme. Great to have you on. We've just heard there from Ashraf Shannon, our correspondent, about his journey from Gaza City to Deir al-Balah and also his wife. What's the humanitarian situation and the conditions where you are?
Thanks for having me. So exactly what Ashraf was saying, I was just in Gaza City 2 days ago, and I saw the number of people that are continuing to flee from the north to the south, and many are fleeing on foot. The humanitarian situation in the south is getting worse and worse because it was already extremely overcrowded. The services were extremely overwhelmed, and what we're seeing now is every day more and more people are showing up, not knowing where they're going, not knowing where their next night will be spent. Many, again, are arriving with almost nothing. And those who are coming, they're coming with maybe a mattress or a plastic bag in their hands. Just earlier today, I met a family who had come from Jabalia, and they told me that they have been searching for 3 days for a place to sleep, and they haven't found one until just late this afternoon. So it's horrific suffering. It's horrific conditions that people are facing, and this is just expected to get worse because, of course, there's still hundreds of thousands of people trapped, and they are, whether they decide to leave or stay, the situation is absolutely catastrophic.
And amid this catastrophic situation, of course, Olga, there is the ongoing famine and starvation. We are reporting today that a 1-month-old baby has died of starvation due to Israel's blockade. And UNICEF is warning that more than 26,000 children could also die of starvation. What have you been seeing with regards to malnutrition and famine?
Well, unfortunately, malnutrition rates continue to soar. And what worries me the most is that the worst case scenario that continues to be predicted will once again play out. And the spread of famine, of course, will be very likely unless the situation changes drastically immediately. And what I see in every hospital that I go into is malnutrition. Just the wards are overflowing, and it's all ages. It's anyone from babies, from newborns to elderly people, and they are really shocking images of people who are starving to death, and the situation just is just appalling.
And with regards to hospitals, Olga, how many functioning hospitals are there now left in Gaza City, and also where you are there, because this is still the middle area of Gaza?
So again, very few healthcare facilities are operating, and of course we as humanitarians, we continue to try to provide services through primary healthcare centers or other type of healthcare facilities, but of course the main hospitals are really struggling to operate. I was in Nasser a couple of days ago, or a couple of weeks ago in Khan Yunis, and they were hosting patients in the hallways, in the balconies, in the parking lot, and just every ward was completely overfilled. I just saw a picture yesterday or 2 days ago when I was in Shifa of babies in an incubator, 5 of them in one incubator because there's just not enough space. And all of these facilities are overwhelmed. The hospitals are reporting that they are lacking blood. And of course, this is amid mass casualties that continue to arrive in these hospitals.
Olga, thank you very much indeed. Olga Cherevko from the UN Office for Coordination of Humanitarian Affairs in Gaza. Good luck with your work. Thank you so much for making time for us.